Bismillahirrahmanirrahim. Good morning. Assalamu alaikum, ladies and gentlemen. The Dawn Group's CEO, you're the CEO now, Naza Freen, Segal, and MNA Shaista Malik, eminent former ministers, Farooq Sattar, excellencies, the diplomats here, friends from the media, and most importantly, our development partners. I don't mean in a financial way, but those who have been holding the candle up in times when no one was interested. And for that, I must recognize the Population Council, for which the Population Council is run by Zeba Sattar. And I do want to give her the credit for keeping the conversation going when no one really was interested. So thank you for convening this, the Dawn Group. It looks like we have a silent partnership on being the patron of subjects no one really cares about at large scale. But I'm wrong here, obviously, because people do care. All those in the room are here because they care. And I think that in itself is a token and mark of, give us a mark of appreciation, to remember that these are subjects that are growing steadily closer and closer to our hearts and minds. But what's the challenge, ladies and gentlemen? I hear that a minister is missing, so I told Naza Freen, if I may use your first name, because I worked with your mother in the Dawn Group, that we are, well, the upside is that we have more time to talk candidly. And here, not that I think ministers shouldn't, they should, and that's what makes any discussion so compelling. I had assumed there will be some kind of, because the planning minister was here, some kind of scene setting, which he's very good at doing, on the data that is driving the pressures on climate change. But I'm going to pepper some of the discussion with that, and let's see if we can stay engaged on the subject and not bore you all this time of the morning. So, ladies and gentlemen, how have I become interested in population? Because, well, it's something that we've all been talking and reading about. And 7 years ago, I wrote about 3 ticking time bombs for Pakistan. Unchecked population growth was one of them, water scarcity, and of course, climate stress. In my view, they are no longer ticking. They have noiselessly exploded around us. They've already done the damage that they needed to do. Let's look at water. Water is scarce, and it's 2025. I remember shouting from Parliament that Pakistan will be water scarce, not just stressed by 2025, according to the UN. Here we are at 2025, and we haven't thought about the huge amounts of water that are missing in our communities and our cities for our citizens to use safely and conveniently. I see it as a fundamental right. Climate obviously is at its frontline heat in Pakistan, as we are the most vulnerable country globally from 2022, according to the Global Risk Index. Now, population growth, in my view, and I'm sure everyone agrees, has passed some kind of a danger line. Why I say that is because it means you have the figures in front of you, 251 million, and those glaze our eyes. Just to break it down a little, it means 6 million more people every year. Now, of course, we love people. We love our people. We love children. We love births. We mourn our deaths. What goes around here is the pressure on our resources. The word balance has been used in the title of the summit, in its subtitle, and I think that's where we need to find our pivot. Where do we find our pivot, and why we say that this is such a crisis now is because we need to wonder why so many of our children go hungry. Malnutrition is a big number here. We also need to then ask how will our health clinics, already in deficits, service the sick, the needy, the women and the children needing urgent care, or why we have 26 million children out of school. You see, these are very important numbers, and added to that, Ms. Nasafreen Segal mentioned the youth bulge. Pakistan talks about this demographic dividend non-stop. At which point does that dividend become a challenge? When you are not able to provide the 1.5 million jobs needed per year. That's needed per year because the population is also growing. This youth bulge is unaccommodated, is looking towards a future where even if they have a degree, they are unable to find the jobs they need. So, these are things that we need to think about in terms of how the population growth is taking us, where it's taking us, and what pressures it's putting on our economy, on our per capita incomes, and of course, the lived reality of people, especially the 45% that are now under the poverty line. These are not my figures, these are the World Bank's. Now, with our economic growth dragged down by climate shocks and institutional frigidity, let's not pretend that is not the case, we are not able to lift millions out of the poverty that I spoke about. Quite the opposite. If GDP gets impacted at 8%, like it did in the 2022 floods and a lower percentage in the recent floods, population numbers stretch those losses further. There's simply more people to save, more people to shelter, more people to feed, house, clothe, and save from the diseases that arise from waterborne standing water that we see then. But, this goes on. Climate change exacerbates all. It's like a multiplier, but then so is population. All threats, all challenges. And then that brings me to consider, I remember saying this to Zeba Sattar long ago, that we must be the only country proving John Malthus and his doomsday predictions, right? I mean, probably the economists will disagree, but basically what he spoke about, because obviously inequality comes into the mix, and so does technology. That's how countries have leapfrogged their population. They have exceeded their economic growth rates above their population. So what Malthus basically said in a nutshell was that if the two rates converge, you've got a real problem. And then eventually, the 20th century and the 21st century proved John Malthus wrong, except right here. If you have a 2.6% growth rate, population growth rate, and your GDP rate hovers around that, it did for many years, and it keeps coming down when there is a climate shock or there's another kind of disaster, you then have the two converging. So, when population growth matches or outpaces GDP, you have a serious structural problem. It presses down on all macroeconomic indicators, and it creates what I call a scarcity crisis. So unchecked population growth creates a crisis of scarcity. You and I don't feel it. We are obviously sitting in Serena Hotel, which has reverted to using plastic bottles. Ahem, management, side note, which it shouldn't be, and we can talk about why, but here's what's going on here. We are in an affluent, or rather arc of elite privilege. We are not feeling the pressures of the population burden or unchecked growth. And when you talk to a person who has 6 children in his or her family, they say, well, we need the children. Yet, they find that the mouths are far too many to feed. In that situation, I call the scarcity vector becoming gendered immediately, because the population crisis is also not a regular crisis. It's not just a plain structural crisis, it's a gendered crisis. It is experienced most by women and also by vulnerable women at the bottom of the social pyramid. And now that social pyramid is 45%, right? So, because when there's not enough food on the table, the food goes to the boys in the family. Mothers do this. Now, I'm talking to you about what happens in communities and tables where the mouths are too many to feed, because this is what it's about. If you can feed your population, if you can give them clean water, and you can build their resilience for the future, then you will be able to guarantee them the jobs, your economy has the bounce. Right now, our population is at 241.5 billion, since the presentations are not here. And I'll say that this makes us the 5th most populous country in the world, right? Now, 2.55 is the annual rate. I would suggest it's 2.6 at the very least. When we're sitting at dinner, we think it's 2.7, because a lot is not accounted for. And so each year, we're adding 6 million more Pakistanis to very overstretched systems. Those schools aren't out there, those clinics aren't out there yet, right? So if this growth continues unchecked, the demographic pressure will nullify per capita GDP as well. At a growth rate of 2.7, wherever you go, every citizen will feel very little improvement. They will not feel the improvement in their lives. So even a 1% increase, a 1% increase in population growth reduces per capita income at 35,000 rupees annually. Now that's a very big number. There's been a lot of talk about why we are not able to understand how our future is going to be flatlined. I think we do understand it, but we have not figured out what is a priority. This is a development and daily priority to me, like climate change, like providing water. And I want to tell you how they all interconnect, my ticking time bombs, which have exploded. We're already water scarce, the bell was tolling, and we are now one of the 3rd most water-stressed countries in the world. None of us here probably experience water scarcity, but that is not how it is lived as a reality in large swathes of Pakistan, including even affluent communities. And if we continue at this rate, which when our population will reach 315 million in 2050, then you're going to need 60 million acre-feet more of irrigation, just irrigation water, to keep the country moving. We don't have the storage, we don't have the capacity right now. So, there's no rocket science. We have to reduce our consumption. Pakistan is one of the most high-consuming water countries. Our usage of water and therefore its waste is probably the 4th highest in the world. So before we start rushing to the limits of saying, why haven't we got these huge dams, which are a thing of the past? Huge dams no longer get the consortium financing, they have huge run-over costs, and they displace communities, and they also stop the run of the river. You have 2 large storage dams, and they generate hydel, and the energy experts will tell you more, and in any energy conversation, this can be addressed. But the pressure on water, which I feel you cannot talk about population without talking about water, is really about who bears the burden. The stress on women, the stress on scarcity. Why do I bring women up again? Because they are carrying the water. You don't all have it in your taps. In Pakistan, 72% of a woman's day, of 3/4 of women in Pakistan, is taken up carrying water. Shocking, isn't it? But please look at the statistics on the world over, Africa and other communities, especially rural communities. The women are carrying water for miles on end. That also goes for high urban density populations and cities where water is carried from a central tank because it just isn't available. Or say, for instance, in Ormara and Balochistan, there'll be one pump in the center of the village. So you're going to, this is how it's experienced outside our heated rooms. And that's the important conversation here, because unchecked demographic growth will outrun our water resources. It imperils security, food, as well as water infrastructure, and the public health capacity to cope, to actually emerge resilience, because resilience becomes too much of a buzzword for everyone to use wherever they want, convenient. But it's linked to things like having the sanitation in your neighborhood, the schools in your neighborhood, the hospitals in your neighborhood. It's linked literally to development per capita. And that's one report that I will be bringing Dawn in a month or so. The vulnerability index has been done by the Population Council, well done, Population Council, and we'll be bringing a resilience one soon, how to actually measure that. So food, climate, and poverty are all impacted. You know, we now have children that are 40% of children under 5 are stunted. Again, this is simply because of malnutrition. And one more thing, because women, their mothers, are not able to make the health choices that they need to, or on spacing of births, or how to find the food to feed their children, or how many to have in the household, because they cannot feed all the children, including boys. So you have this crisis, and it usually does not get addressed or linked like this. It is entirely linked to unchecked population growth, and of course, the non-access to critical resources, including food, water, schooling, all of this. But food and water and malnutrition are making this happen. And the women's ability to say, we cannot continue to bear 5, 6, 7 children. Okay, because their bodies are the front lines for decision making. And this has to be addressed squarely. I also want to talk a little bit about how the job market will be impacted, or rather the lack of jobs. We have a 7% unemployment rate. That's high. And we have then young people graduating, unable to find the jobs, and then you see the serial discontent. What that does is it raises discontent in the state's ability to provide them a climate where employment is easily available, where their household won't lose 4% of their savings every time there's a health trauma. It's much more, or there's a climate, the rain takes their roof out. So people lose, households lose huge percentages of their savings and income. Their disposable income is restricted when there are many mouths to feed, and there's a health trauma, or there is a climate shock now. And those are the most recurring in Pakistan's current realities. Any economist will tell you how much impact one health shock makes and sets back a family of, say, 5 to 6, because, well, it is a family of 5 to 6. What can you do right now? But what you can do is start understanding that is not a neutral demographic trend. It's a public health crisis borne by women and children, and of course the men who have to provide. Now, what that does is it compromises reproductive rights. I will get to the part of what needs to be done, but what we do need to understand is that there is demand for the C word, for contraception. Contraception prevalence rate is what you need to talk about, okay? CPR of another kind. We always think of it as the life-saving CPR, the cardiovascular CPR, right? Less people have heard about contraceptive prevalence rate. That's what you need to talk about, because contraceptive usage is what will lower the birth rate, the fertility rate in our country, which is extremely high. It's the highest in Asia. Now, what that does, the inability to have contraception available easily, cheaply, we will come to why that needs to be cheap, and accessible as a family decision, it makes women constantly bear the burden of pregnancies that their family is unable to provide for, or they are. So every 50 minutes before we finish this session, a woman in Pakistan will die due to pregnancy or childbirth complications. She will not have access to a health facility, and perish the thought, and the thought is not perished at all, you will have a climate shock. In 2022, it seared on my brain that 650,000 women were giving birth or facing pregnancy on life rafts, or if they were very lucky, under a plastic tent, a tarpaulin. Plastic is a bad word. So here we have a seriously gendered crisis, 50 minutes. So you then have women facing trauma. You have 11,000 maternal deaths after that. And we have child brides. We have child brides who cannot speak in their family environment where decisions are made for them, or a husband who has the prerogative of male privilege, which is bestowed on them in their homes by their families, and the young brides can't meet that challenge. So 1 in 6 women in Pakistan were married as children. How will they make health decisions, you tell me? This is a reproductive health crisis also. And that is why we keep pushing in Parliament, in Sindh, and wherever province we can. Now all provinces have to do this. I think we only have Punjab coming up soon. I'm certainly not going to finish in 2 minutes. I only have Punjab coming up soon, and I think KP. The other provinces have all gone, Sindh, Balochistan, and thank God, Islamabad Capital Territory, it took 20 years, has finally passed the Child Marriage Act. So children, you are a child until you're 18 for your driving license, for voting, but not for being married, okay? So the age of maturity counts in the reproductive health choice you make. She will also be better educated, obviously female literacy also counts, to be able to say, well, I think that we need to space our births. And what has been helpful, so the good news here is that the Council of Islamic Ideology has actually given this their sanction. They have. It's not religion or that kind of, it's more cultural taboo holding people back, holding families back, that this is a decision of some, other power. No. These are decisions made in the here and now, and the Council of Islamic Ideology, please repeat this everywhere, has said that births should be spaced. So I think we have all the cultural tools which should help us meet the actual unmet need for contraceptives, which is right now only 17%, but it's still there. That's the unmet need for contraceptive. But the demand for contraceptive usage also has to go up and be created. Now we can talk about how that needs to be done, because this is important. The current contraceptive use is only 34%. The CPR will therefore hover at this unhappy scale. So you can do 5 or 6 big things. I'm not going to suggest intractable issues that will take another 5 years. It shouldn't, in terms of, structural matters like population not being part of the NFC mix. That's, of course, one of the things that needs to be looked at, but there are many things that can be done. One of them, and since we're in Islamabad, at the federal level, I have to thank the Prime Minister for putting together a task force on which some of us serve, and also giving it attention. First of all, it needs national attention. Very basic, but that's what it needs. It does not need just one population council to carry the torch. The state at the highest level must give it its focus, attention, and heft, okay? So that's started. But what else do we need from the federal government? I would say that we would need the population fund. There is a population fund, funded. We need that fund funded, even if it's 10 billion, because that's what it is supposed to be funded at immediately, but not just stick it there and park it as part of the PSDP. Ring fence it with allocations for the most vulnerable districts. That's where you will find the money well spent. You can identify 40 districts or 20. The task force can do it, the population council can do it. The tax, I think it's 18%, Zeba, if I'm not mistaken, on contraceptives, right? That's already been done, I'm told, from pressure around the table, but we need it to be notified. Contraceptives need to be cheap and easily available and not taxed, okay? This is a fundamental right. So that needs to be done, the decision's been taken. Family planning, all provinces should pass, but that's coming too far then. Integrate family planning into, social protection programs like the Benazir Income Support Program, Sehat, Sahulat, Aghosh, Mamta, there are many. Each province runs their own. That if they integrate that, we will see some traction. And some level of national coordination just at the federal ministries, health, education, women's development, social welfare, and climate resilience. Please include the water and climate ministries in these consultations, right? So other than a whole of government approach, the data-driven interventions, etc., what do we need from the provinces and also from the center? The one thing that can change the game is reintroducing a scale-up of what is known, very boring, but Lady Health Workers Program. This will completely change the balance on the ground. I say this because, there is proof that the birth rates went down when the lady health workers were at critical mass. And I say this not because, Shahid Benazir Bhutto brought this about, and Shahnaz Wazir Ali is sitting here, she was her partner in doing so. It made a huge difference. The lady health workers are able to go into homes, access the inner, sanctum of a household, even if there's parda, and have discussions with the family. So you locate agency with the woman, but also advise the man of the family on the virtues and on the benefits of spacing births and having less children. When that happens, you automatically see traction. You see the families reaching for birth solutions, birth spacing, and contraception. So we have numbers also. Somebody will share it with you, I'm sure. But we now have a situation where the lady health workers are shrinking. Some of the provinces are maintaining them. They're even making them the polio vaccinators. These lady health workers have become the polio vaccinators. So they're really the backbone of the entire health service here, and it needs to be expanded with mobiles, and the federal government needs to do one thing. It doesn't need to worry about having a population ministry. Please don't add ministries. Please don't. Just tell your information minister, we are allocating this budget for you, and do a population and family planning blitz in the language, in the national language. The provinces then go down and start going into their local dialects and vernaculars, start putting this on phones, on Androids, on anything. And you will have yourself a campaign that goes into your doors. There are NGOs who will provide question and answer services, again available on your unsmartphones in the villages. And that's where you will have access to healthcare, to reproductive choices. And that that recording is then played to the whole family, where it's a remote district you can't access. There are many NGOs, I can refer them all to you, who will do this and who won't necessarily charge. So you build public-private partnerships at the provincial level, and you ask also faith leaders, when you do the national campaign, the faith leaders the Maulanas and all of that, when they make a Friday sermon, to speak about this, because some brave faith leaders are able to. And I say brave because this requires a little bit of courage. People don't even want to talk about contraception. So that's the key word. CPR has to be pushed. And it will find remarkable acceptability everywhere. And to all health ministers of all provinces, I would say they need to amp up their campaign in the communities and even offer no cost, absolutely no cost solutions, like one province is offering even vasectomies to men who are taking it up. But there are many solutions which I'm sure will be unpacked here. But the main one here from federal is fund that population fund. Don't tax the contraceptives again, and if so, notify the one already that you've agreed to. Build the momentum, build a national momentum. The provinces will follow. They will see the benefits. As you have noted, Sindh and KP are already doing so. Sindh is very active, and the health minister will be here. She's been even making local videos in her language, in Sindhi and Urdu, to transmit the message, and we find that it has many takers. So if we don't want our futures to be flatlined, for our children to be able to go to schools, already, as I said, 26 million are out of schools, and find the health care, the women to find the health care that they need, for families to put food on their tables, simple things like that. You will be talking about Malthus later. That's what you need to do. And I really want to thank the Dawn Group for, again, being the patron saint of what I call subjects no one cares about, like me, and taking forward a national conversation which is entirely necessary. The climate change conference was excellent too, and I heard someone trolling and asking, what outcomes were there? It is not your job to provide outcomes. The outcome makers are all here. Your job is to provide the public and national conversation, and thank you for doing that. I hope we continue to address this subject at the highest level. Thank you.